from Miami Beach. Don't think that you could just keep doing heat treatments over time and it's going to be healthy and have no problem. These things can slowly damage you. I saw several patients yesterday with really bad skin coming in for facelifts. And this is important because facelifting is meant to make us look more refreshed, youthful, and younger. And it's done by lifting. Sometimes we add some volume to the face to brighten the face as well. But the number one most important thing, or the biggest, most important organ we have that we use in facelifting is the tegument, or the skin. That's all this stuff. What's the purpose of lifting if you're going to still have bad skin? You're still going to throw shadows. You're still not going to have that bright appearance to you. And realistically, you really limited your result. So with these patients, I try to explain to them what's happening in their skin and why it's important to brighten it. So with aging, we see the superficial part of the skin can get sun damaged. And we're all familiar with that because we see it on everyone's face. What we don't realize is that there are several layers deep to that actually affect how that superficial layer looks. And that's different for the eyes than it is for the cheeks than it is for the lips. The tissue layers are a little different. So to walk you through it, superficially, we need to fix Vina's face, Vina Neves, and on your right. So Vina's face is a good example. So superficially, when you get sun damage, you can get seborrheic keratoses, you can get little sunspots, you can get a bunch of different things. The most common that we see that's concerning is a form or a variety of melasma. Melasma is superficial skin pigmentation. Melasma can happen from sun damage in areas up over here, especially around the cheek. It's very common. It can happen from lasering, which is like sun damage on crack. So if you laser someone who has pigmentary issues, it's just like putting them in the sun and accelerating it. And you get it from hormonal changes as well. When you go through hormonal changes rapidly, the pigment in the skin gets more reactive for some reason. So you do see that it's upregulated. For melasma or superficial pigmentation, we can treat patients with chemical peels, with lasers. Those are aggressive ways to get it off. If it's skin that's sensitive and going to react, things like that might just make it worse. So we just give people creams. Creams that can lighten you, creams that can calm the skin. There's a bunch of different creams you can use. Creams that can make the skin look younger. Retin-A is a common one that people use for better skin turnover. So skin turnover goes faster and your skin peels off faster. It also allows better depth of penetration of the different creams that you put on. That's why people use it. But you don't want to use Retin-A on sensitive areas like here or around the under eye, so it becomes limiting. Now let's say nothing's working and you're Asian and you got bad melasma and you want to know what else to do. Well, there was a study done amongst Asians using tranexamic acid, TXA. This is an IV medication or oral medication that we use for women who have heavy menstruation, heavy periods. We've also found that it helps with melasma. If somebody takes melasma with recalcitrant or resistant melasma for about 1 to 3 months, just depending on how long you want to put them on it, you can lighten the large majority of these people who don't lighten otherwise. That's the melasma. There are the fine wrinkles and texture and things like that. And for those things, you have Retin-A also. You have CO2 lasers or erbium YAG lasers, which are fractionated lasers, which help superficial texture by ablating the surface. That means it explodes water and ablates the surface. They also can go a little bit deeper and cause coagulative necrosis or other deep damages in the dermis to tell your body to remodel and make new collagen, other than just burning things off. And then you have radiofrequency. Radiofrequency, there are a lot of different types, and I'll talk about that totally separately because it's confusing to doctors and to patients, all the different types of radiofrequency. But radiofrequency can be used superficially to stimulate the skin, like microneedling. It can be used deep to melt fat, and it can be used just in the middle to go and thicken the dermis or help the dermis get healthier. What is below the skin? We've got the epidermis, we've got the dermis. Under it, we've got more important layers as well. The one right under it is called the SMAS. The SMAS is the superficial musculopponeurotic system. This has its own thick hydratoroid layer that's interspersed with fat molecules and a bunch of hyaluronic acid and fluid amongst other tissue. And then when you go deep to it, you have some mimetic musculature, so smiling muscles that it wraps around. So the SMAS kind of covers all that. But what I'm talking about is the thick part of the SMAS that you have on top of the orbicularis oris muscle, or the thick part that you have going over the zygomaticus complex and down into the buccal. You also have your fat pads in the face, and there are the granular fat pads, which we would call the superficial malar fat pad, or the lower fat pads that you see around the zygoma, and then you have your buccal fat pad, which is totally different. And they contribute to appearance of skin in different ways. The SMAS is very, very important. If the SMAS becomes deflated or damaged in someone's face, it can start to make the whole face look darker. It is what is probably the most responsible responsible for the hydratatory potential or the cushiony appearance of your face. When you get rid of it, the face starts to throw shadows everywhere, not just where it's folding. So the SMAS is super important. I do see patients who come in and they have an exaggerated appearance to their face because their SMAS is shrunken. That could be because they have scleroderma and they've had multiple bouts of fibrotic reactions in their face where the SMAS just shrinks down. It could be from dissolver and filler, meaning they got overfilled, the skin got damaged over time, and the SMAS is really where a lot of the filler stays. And when you dissolve it, you have all these microcystic little areas that had expanded and it collapsed in an exaggerated fashion after you dissolve. And that doesn't recuperate so well in the mid-face. And I did see 2 patients like that yesterday who didn't understand why they looked darker, but when I told them their timeline matched up, and that's exactly what happened. I saw 2 other patients who had deflation in the SMAS or the fat from repeat radiofrequencies. And the type of radiofrequencies you have are the wand-based ones, which generally you don't want to put in the face. You don't want to put AccuTite in the face or FaceTite and melt the fat layers and melt the SMAS. You're going to shrink them. People imagine that you tighten these layers concentrically and you get a lift out of it. Realistically, that's not happening. You're microwaving them and you're shrinking them and reducing their thickness. So the support for the skin over time ends up going down. It's not shrinking and tightening like you think. You do get some fibrosis and contracture and density in that area because you scarred it down. That's where the tightening comes from. So it's important to be cautious when we're doing these deeper types of radiofrequencies or heat-based treatments in the face or repeat heat-based treatments in the face, because even if you're not melting the fat, you have to remember the SMAS is there. And even if you're not melting the SMAS, you're going to cause a fibrotic reaction there, and eventually it's going to sclerose, it's going to scar down. And that's very, very common, and it's common amongst people who do over-aggressive single treatments or over-aggressive by doing multiple treatments. So you have to be cautious how many heat treatments you're doing. Even CO2 laser, when it's overdone, can do that. The layers deep to the epidermis and dermis, which is what we consider the integument, are just as important to the appearance of it. You have to keep them intact, and it's impossible to replace them. We can't go and replace a damaged SMAS. We can't go replace lost fat in the face. We'd have to take fat from somewhere else and try to replace it. So we have to be cautious and make sure we keep this our entire lives, or you end up like these ladies in my office who are getting darker, are getting older at an accelerated rate, and they don't know exactly what's happening. What do I offer them when I see this deflation? I recognize the deflation in the face when it's caused from SMAS or fat deflation. It's a different type of darkness and collapse. I tell them they can do nanofat PRP. If you take nanofat and PRP and inject it back into the dermis, subdermis, and SMAS, you'll actually get a surprising amount of rejuvenation in those areas, and patients' skin just turns brighter. A lot of that is from the return of hydratatory potential of the face, where the face, like a sponge, starts to inflate again. That's decently easy to treat. The hard one is when there's damage with age or sun or lasers to the dermis and you get that dry appearance to it. That's really hard to rejuvenate. I still use nanofat PRP for that, but what I do recommend that's very easy is to do microneedling. Microneedling is touted for collagen production. It doesn't really produce much collagen. What microneedling by itself or microneedling with PRP is good for is stimulating the skin. I like to tell patients to go do it maybe 3-4 times a year. What happens is they needle the skin gets pissed off or stimulated, your immune system wakes up, comes and tries to heal the area, and in doing so hydrates it more aggressively. So now chronically dry skin becomes more hydrated. People use oils, hyaluronic acids, retin-A, and these things can have a positive or negative effect just based on your skin type. You never know. Microneedling unlikely has any negative skin reaction. Microneedling RF or radiofrequency is totally different, so not the same kind of thing. The message in the end of all this is, if you're in the position where you're trying to go get a facelift because you want your face to look brighter, nicer, and younger, you first need to focus yourself on improvements in the skin quality, and you need to be religious about that. That's why I always send my patients to Jen Hollander first. I say, go see her, start going on a skin regimen, make your skin brighter. When I'm talking about skin, I'm never just looking at the outer skin, I'm looking at what's under the skin too, because I recognize it. I've seen it so many times. So I look for deflation, and I look for darkness, and I look for different things that you see over time that happen again with age, with filling and dissolving, or that happen with heat-based therapies or repeat bouts of scarring, again like scleroderma and those kind of autoimmune issues where you get rapid dehydration and skin quality changes. So you have to treat all of these when you are looking at the aging face. So it's not just one level of skin integument. You have your SMAS, you have your fat. Below that, there's the mimetic muscles. Below that, there's fat pads again. And you need all of them. The mimetic muscles, the smiling muscles in the face, do not function properly when when they are bogged down with a lot of fluid like filler or silicone, and they don't function well when they're denuded, when they're stripped down. If somebody overheat treats or over dissolves, the muscles start to work a little weird. They contract too much or they relax too much. It doesn't function well. And when you get rid of the buccal fat pad, that's an entirely different one that I just touched upon. The buccal fat pad is a support structure for this part of the face. So when you get rid of the buccal fat pad in some people, you start to see collapse here, and it's a whole other type of darkness that you see in people where they start to get indentations here in front of the pre-jowl fold is what I call it, or the marionettes as it comes down. So all these things are important. You can't replace them. So this is more, I'd say a message for like young people especially. Don't think that you could just keep doing heat treatments over time and it's going to be healthy and have no problem. These things can slowly damage you. Just think about it, they just slowly microwave your face when you keep heating it too much. Or if you get too much filler, you've expanded it now, you've damaged your tissue, and somebody's going to go try to dissolve you, and the dissolver is going to now deflate you so much because you were overexpanded already. So take it easy on all this stuff and don't think we can fix it, because we can't fix everything. Happy Thursday for the Wednesday message from Miami Beach.